This is Rosamund. She is a public health doctor who works at MSF, and she's going to talk to you a little bit about use of maps, about field stuff,
use of maps.
about interesting fields type stuff.
Pictures, basically. Thanks, Pete. Evening. So Pete, I work for MSF. I'm a public health doctor. I work in our London office and in the field. And so Pete just asked if I would come along tonight and tell you a bit about why MSF needs the work that you do and the impact that it has for our work. So I was just going to talk about very briefly about two settings. If you have any questions while I'm talking, please just stick your hands up. So I was just going to talk a bit about our work in South Sudan and a bit in the Ebola outbreak. So South Sudan, where I was working last year, it's the youngest country in the world, but it's already mired in a civil war, a really brutal civil war. People get displaced recurrently. The villages are attacked and burnt. They move into the swamps. They move around. They might spend time in refugee camps. The main source of food is what people can grow, but if you're moving around all the time, they can't grow food. So we had major concerns about malnutrition and famine. And this is something we can really do something about in MSF. This is a picture of a chap I met in our camp Bentiu in South Sudan, in the north of South Sudan. This was him about 6 weeks before I arrived with one of my colleagues, and this is the same smile on a much chubbier child after he'd been in our feeding program for 6 weeks. So if we think there might be malnutrition going on, we want to try and go and assess that. So we'd heard some rumours that in the east of the country, there was possibly some food insecurity going on. As I said, the country's in civil war. There's a lot of insecurity. It's very hard to travel. And during half of the year, roads are impassable. And there's very little communication, no satellite phone network. So we had very little information about these areas. And you only get one chance to go there. You go in by a helicopter, which is very expensive to buy. You have very limited time there. And that's your one chance to do an assessment. But to do an assessment well, you need to know where people are and how many people there are. In order we can plan, as Pete mentioned earlier, how to do a survey scientifically so that you get reliable, true results. But we were just working, as Pete kind of mentioned, off this map. This is all we knew about roughly where the villages were. We were asked to design a survey and plan a survey for this. So we got in touch with Missing Maps. Very helpfully, we pointed out the villages in the far east of the country we wanted to survey. We'd heard rumours about. The Missing Maps had a couple of Mapathons, such as this evening, and produced us some maps like this. So as Pete said, this immediately allows us, these are all the houses and the various villages in the area of interest. So this allows us to plan our survey, come up with an estimate of the population, and even down to the fact we can plan how many staff we need, how much time we need, and we can plot them a route even through the villages that they've never been to, we've never been to, get the surveys done quickly, find out what's going on. So that's what we did for the village of Mading and a few villages around it. This is one of the ways we assess malnutrition, is just measuring the circumference of the arm. If it comes up on the tape as being red, then this child is malnourished and needs some treatment. So we went to a few villages, Mading and around. Happily, there was no major malnutrition there, but they were found to be kind of borderline. We need to keep an eye on them. Some people say in one village are already having to go down to the local river and have started eating the roots of water lilies that they could find in the river because of food shortage. And then just briefly, how we use Missing Map work in Ebola. So the main thing you hear about the Ebola response is the people in the spacesuits, PPE, in the Ebola hospitals. But actually, to reduce the outbreak, to fight the outbreak, it's largely about going and finding cases, educating people in communities that are affected and communities nearby to try and reduce the spread of Ebola. We'd have people come into our hospitals. We wouldn't have a clue where they'd come from. They'd tell us the name of their village, and we were working off maps like this. The village wouldn't be on the map, or there'd be several villages of that name on the map, or they'd tell us the name of the village. It would be completely mapped in the wrong place, because these maps were just put together, I think, by a group of local people who had nothing better to do one afternoon. So again, Ivan, a colleague of ours, got a group of motorbike owners in the area. He gave them all GPS machines. He sent them out into the district. They went to every village. They took a GPS coordinate, found out the name or the several names of that village, and then the missing maps put it all together on better maps for us. So this meant that actually, especially towards the end of the outbreak, when it's really key that every potential case of Ebola is investigated to try and stop any more small clusters breaking out, we could hear about a patient or a suspect case. We could get out to investigate and see if they needed to come to a hospital. Decontamination teams could get out to the villages, the correct villages, quickly, promptly, and when they chlorine spray the inside of any affected houses. And really importantly, we could get out to affected villages and the villages surrounding those to try and really, initially at least, convince people Ebola is real, and communicate messages about how to reduce the risk of spreading Ebola. So just 2 instances where missing maps work has been really key in MSF's work around the world. So from all of us at MSF, we just want to say thank you for your hard work.